Do you know what is one of the most common neurological disorders in the world? It's epilepsy, a chronic neurological disorder characterized by recurrent seizures, which are sudden bursts of electrical activity in the brain. These seizures can manifest in various ways, including loss of consciousness, convulsions, and temporary changes in behavior, emotion, or sensory awareness. Epilepsy is a global issue, affecting a staggering 50 million people worldwide. It's particularly prevalent in low and middle-income countries, where approximately 80% of all cases are found. Factors contributing to this high incidence include limited access to healthcare, poor sanitation, and inadequate maternal and child health services. Living with epilepsy can present significant challenges. People with this disorder often face social stigma, discrimination, and limited opportunities for education and employment. They are also at an increased risk of injuries, accidents, and premature death. Epilepsy is a broad term that encompasses many different types. Some of the most common types include focal epilepsy, which accounts for about 60% of all cases, generalized epilepsy, and absence seizures, which are most common in children. The causes of epilepsy are complex and not always known. However, risk factors can include brain injury, genetic predisposition, certain infections, and other medical conditions such as stroke, brain tumors, and certain metabolic disorders. Diagnosing epilepsy involves a medical history, physical examination, and various tests including electroencephalograms and brain imaging studies. Treatment typically involves medication to control seizures, but in some cases surgery or other interventions may be necessary. The good news is, with proper treatment, most people with epilepsy can live seizure-free and lead normal lives. But even with advancements in understanding and treating epilepsy, stigma and misconceptions persist. Raising awareness about the disorder and dispelling myths is crucial to reducing stigma and improving the lives of people with epilepsy. In summary, epilepsy is a common and serious neurological disorder, but it doesn't have to define a person's life. With proper diagnosis, treatment, and support, people with epilepsy can lead full and productive lives. Remember, knowledge is power, and understanding epilepsy is the first step to acceptance and support.